most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about proven ways to lower your blood pressure naturally. The American Heart Association defines normal blood pressure as 120 over 80.
Okay.
And 140 over 90 is considered high blood pressure.
Right.
And in between that, you're pre-hypertensive.
So you're almost there, but you're not there.
Yeah, exactly. Usually not treating it yet.
It's like the yellow light. If you're coming up, green is go without any concern. Yellow is wait. You may have a problem.
Very good. I applaud you for that.
Oh, thank
Brad.
you.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media channels because check them out. We are always giving something away. Always.
Yes.
Instagram.
What are we doing this
Facebook.
week?
I don't know.
We don't know, but we know it's
we're doing it in the future, but it's something really good. So check it out. It's in our description below too. So let's talk about these, Brad. So I got 7 ones. We actually could have called this 7 proven ways to lower your. You want to add the 7 down there? Number 1 is flaxseed. These are natural ways, Brad.
Okay.
So you actually, and they've done studies on this. Now, a lot of these studies are quoted from this book, How Not to Die. It's by Michael Greger, and this is very well referenced. I mean, there's like 65 to 100 studies per chapter.
Oh,
so
wow.
And he talked about flaxseed oil, and he talked about it in the manner that it's almost like as effective as some blood pressure medications.
Oh, really?
And we have one case study here because my wife has started using this. So what she does is she takes the flaxseed, and she takes a couple teaspoons, and she takes it. And then she puts it in her applesauce. So it kind of gives her texture.
Oh, I see.
And she has it every morning.
Yep.
She has 2 every morning. Her blood pressure, I mean, I don't know if it's just this or what's going on, has dropped like 10 to 15 points.
Have you left the house for a while a little bit more?
That would do it. That would help. So, and the studies in the book have shown that, and they've done double-blind studies, the average decreased from 158 over 82 down to 143 over 75.
Whoa.
So about 7 to 8 points.
Right.
And I don't know what the length of time was for that to happen.
Was there anything mentioned about using the flaxseed oil for cooking or anything like that?
They generally like the natural stuff. They I suppose the oil would be natural too, but they don't like anything processed. They like getting it right from the food itself. So, well, you'll have to try that later, Brad. I brought some. You can. This is just regular applesauce.
Regular applesauce, okay.
I mean, there's nothing added. It's just there's no sugar added or anything like that.
What's number 2?
Number 2 is, and the reason I bring this one up, most people know this, but decrease your salt intake. For a while, it was kind of like they were going back and forth on that. But according to, again, Dr. Greger, he said it's been clear over years. They've done double-blind studies that go back decades. Yeah. And they said the problem is the processed food industry is kind of lobbying against this.
I can't imagine.
Yeah, I can't imagine. I mean, not only does it preserve their food, but it actually adds weight to their food. So like if you have salt like in chicken, it adds 20% more water.
Sure. Yeah.
So it increases the weight, which means they can sell it for more.
Right.
So
yeah,
so there's all these forces out there. But there's no doubt about it. I mean, again, if I take my wife as an example, I mean, she was eating this broth that had a lot of salt in it.
Oh, yeah.
Oh, man, blood pressure was as bad as if I was in the room. I mean, it was so, yeah.
They should do a study on that when you're in the room versus when you're out of the house.
There's white coat syndrome. You heard of that? There's Bob Schrupp syndrome.
Yeah.
All right, next one. More whole grains decrease the risk of heart attacks and stroke. However, we say whole grains, we mean oats and whole wheat and brown rice, not refined grains.
Sure.
Refined grains can actually increase your risk of increasing your blood pressure.
So that would mean like in cereals and things where it's gone through.
There's some whole grain cereals too.
Sure.
I eat one, but most of the grains, like even in normal bread, is going to be refined grain.
Right.
They've taken out the good part. So. Number 4, Brad, you can speak to this. Power walks. I mean, you exercise.
Right.
Yeah, I mean, it's just, I chose walking because I think a lot of people feel like, I don't want to exercise, but anybody can walk almost, right?
Well, much more people. And more people are apt to walk than to think about running or jumping on a machine or something of that nature. But I think the exercise part of it, the cardiovascular, but just to get away from things and forget about
there's so many positive side effects to exercise.
Sure,
I mean it just helps your overall outlook on life and tensions and all that. 30 minutes a day, we're going to recommend. Number 5, the power of nitric oxide. So nitric oxide actually opens your arteries and allows the blood to flow. And like you hear if people take nitroglycerin when they're having a heart attack.
I was just thinking about that.
Nitroglycerin converts to nitric oxide.
Oh.
So, yep. And the foods that'll do this are a lot of the green, leafy, dark green.
Spinach.
Oh, yeah, spinach. Beets also, which...
Oh, really?
I'm not a beet person. I don't know if you are.
But I'm assuming not a canned beet. You're better off having...
Yeah, and beets, they don't last very long either. But I think they talked about beet juice even was fine, too.
Well, that's different.
Basil, cilantro, oak leaf lettuce. I don't even know what oak leaf lettuce is. Do you know what that kind is?
Well,
Do you?
I imagine oak tree leaves.
Yeah.
I don't know.
Arugula. So there, you just look it up. Look up foods that are rich in nitric oxide.
Okay.
So number 6, I don't know how to say this. Hibiscus tea.
Hibiscus.
Hibiscus tea.
Yeah.
Okay. Do you drink that?
No, I drink green tea.
Okay. I think that's pretty good too. But they were talking about 3 cups a day, which to me would be a lot of tea. Wouldn't it? How much do you drink now?
On a good day, I put down 6, 8
Oh,
at least.
well, maybe it's not that many.
But
then.
I use the same tea bag. It's just mostly water.
Oh,
so I don't know
see.
if they're saying put fresh stuff in every time. But
I didn't know you were such a tea-aholic. I mean,
well, if there's hot water around, I just keep filling it up and drinking it. As I
right.
do my notes or whatever. Even it's fun.
All right,
it
good
really
for
is
you.
a nice way to enjoy life.
Can I go to number 7 now?
Yep.
All right, number 7 is get your sleep apnea under control. If you do have sleep apnea,
Sure.
A lot of people do have it. They're not diagnosed.
Mm-hmm.
There's that brief interruptions in your sleep, and that can raise your blood pressure. So a lot of times they recommend the CPAP machine. We actually also recommend using the breather. You gonna pull yours out, Brad?
Yeah, I've got it out. It's ready
Okay.
to go. I've got my name on it, so no one else uses it.
So you'll want to go to their website, the breather, and get all the information out. We're just going to mention it today.
Right.
But basically, it's an exercise you do twice a day, 6 days a week. It's 2 sets of 10. You're breathing in, breathing out. It doesn't take very long. But
right. 2 sets of 10 will probably take you 2 minutes.
Yeah, 2 minutes, twice a day. And you can do it, if you have oxygen on. You can do it if you're in a wheelchair.
Sure.
And it was invented by a respiratory therapist. And it's shown to be effective against sleep apnea. So
sure, and we like it. As therapists, it's a good functional way to exercise your respiratory muscles.
Exercise your lungs. It's like weightlifting for your lungs.
Right.
So we have a link below. You can get a discount on this and check it out.
Yeah, and these are really reasonably priced.
Yeah,
They're
are.
They're not going to break the bank at all.
That's exactly right. So it's certainly something I'd recommend. I think that's it, Brad. By the way, we can fix just about anything
except for
a broken heart.
But
we're working on it.
And we're not going to stop either.
But you know what? This is getting closer because high blood pressure can result in a broken heart.
Yeah, things are all meshing together.
So maybe we can fix a broken heart.
A couple more decades.
All right. Thanks for watching.